Welcome back. September is Prostate Cancer Awareness Month, a time to keep in mind that about 1 out of 9 men will be diagnosed with prostate cancer in their lifetime.
To stress the importance of screenings and having the right treatment for this disease, we are joined now by Dr. Nathaniel Barnes and Dr. Shariq Khwaja with Memorial Hermann Cancer Center. Gentlemen, welcome to the show. And 1 in 9, those are pretty big numbers. We were chatting during commercial break. I lost my grandfather after his battle with prostate cancer. Talk to us about just the risk group. Are there certain groups of people who are more at risk of developing this disease?
It is the #1 cancer in men in America. It's still the #2 cause of cancer death, although we've been impacting that mortality pretty significantly over the last 30 years. The at-risk groups are primarily 2 groups. All African-American men genetically are placed in the high-risk group, but then any other man who has a primary degree relative, a father or a brother with a history of prostate cancer. And then there's the ultra-high-risk group when you find clusters of 2 or more primary degree relatives with prostate cancer.
And Dr. Khwaja, if we could just break it down, and we hear a lot, of course, this is Prostate Cancer Awareness Month, the month of September, the color blue. We see a lot of these campaigns, but let's just break it down. What is prostate cancer?
So to understand that, we have to know what the prostate is. The prostate is a gland, just like the tonsil is a gland. But this gland, the prostate gland, sits in the male pelvis between the bladder and the rectum. And sometimes cells in this gland can begin to divide uncontrollably. And sometimes they can become a cancer.
The good news is it is relatively slow growing, correct? And that if this is discovered, it's quite treatable?
That's absolutely correct, and it really depends on screening programs, and I know we're going to talk about screening in a lot more detail.
Yeah, and Dr. Barnes, let's turn to you for this screening. Let's talk about just the process of getting screened, and at what age, I mean, for men like myself, at what age should we start requesting these screenings from our doctor?
Well, I really like that you use the word request. Ever since 2014, there's been a move in medicine where, in primary care arenas, that the patient should engage the physician in a discussion before that screening starts. And that's where most of it occurs versus in the specialist office. In men who are in the ultra high risk group, as I mentioned before, you really want to start screening at age 40 for those men. In the high risk group, African Americans and somebody with a primary degree relative, we start at age 45. And in the low-risk group, we start screening at age 50 years of age and generally extend that annually for most patients until age 70 or 75. The screening is pretty simple. Primarily, the screening consists of a blood test, PSA, prostatic specific antigen. That may be paired with a digital rectal exam, but the PSA is the most specific we have right now at our utility, and it merely is a blood draw, less than $100. And it can easily obtain in any general laboratory.
And let's talk about prevention, because I feel like this needs to be talked about. You know, we don't want heart or lung disease, stop smoking, or, you know, it seems like, well, tell me what not to do. And there really isn't sort of a foolproof method here. Is that right, Dr. Khwaja?
That's absolutely correct. When we talk about risk is defined by our genetics and the environment, and particularly the interplay between the two. There is currently no foolproof way to prevent prostate cancer. And really the best course of action that has been associated with decreased lifetime risk is a healthy diet and regular exercise. But other than that, there isn't any concrete foolproof way to prevent prostate cancer.
Healthier diet, regular exercise, which are good, good things
Habits,
in general, right? They can help us avoid a lot of disease. Let's talk about treatment. In the event that, that you or someone you know is diagnosed with prostate cancer, is it a combination of treatment therapies? Because I understand that there's also a kind of a range of roads to go down here.
That's absolutely correct. And really, this is a discussion that should be had in a multidisciplinary fashion with a urologist, a radiation oncologist, sometimes a medical oncologist. And I'm going to let Dr. Barnes talk about the urology aspect.
And we're working to get Dr. Barnes back on virtually,
Sounds
too.
good.
So if you can continue, that would be fantastic, Dr. Khwaja.
Absolutely. And from a radiation standpoint, there's external beam techniques And then there's something called brachytherapy, which is a way to deliver localized therapy directly into the prostate. And chemotherapy, as you bring up there, is something that our medical oncology colleagues certainly specialize in. And it ultimately is a matter of developing a personalized care plan between the patient and the providers, which include the urologist, radiation oncologist, and medical oncologist. There are some situations that surgery is the right course of action. Some situations where radiation therapy is the right course of action. And sometimes it's a combination of all of these different modalities. So this is where having a clinically integrated team that works in a multidisciplinary fashion will give our patients the best care.
And thanks for being patient with us, of course, working with Zoom on these virtual calls. We're working to get Dr. Barnes back in. And while we do so, if we can, Dr. Khwaja and Dr. Barnes, if you're able to hear us, we talked about screening, we talked about prevention. What about signs? Are there any warning signs that maybe something might be wrong?
Absolutely. And, you know, the prostate is like I mentioned, is an organ that sits in the pelvis, and a lot of times in the PSA screening there is no signs or symptoms, but certainly anything in regards to urination needs to be addressed with the primary care doctors and potentially urologists. Prostate cancer is a cancer that can spread to the bone if it does spread, and so bony pain is another potential sign of more advanced cancer.
And I do believe we do have Dr. Nathaniel Barnes, who is rejoining us now through the miracles of technology. But guys, before we let you go, because we are very tight on time, we should underscore early detection is key. And in order to have that early detection, we got to get screened.
That sounds great.
Absolutely. I mean, early detection is key, particularly in high-risk groups. If diagnosed early, our opportunity to impact the disease positively and to even cure the disease is enhanced.
Dr. Nathaniel Barnes, thanks. We were glad that we got you back on the call here. And Dr. Shariq Khwaja, thank you both for joining us today. Great information. Also, I think it's important to continue the conversation, that line of communication. Are you feeling good? Do you have symptoms? Let's go get this checked out is really important as well.
Gentlemen, thank you.
Thank you so much for having us.
Thank you.
And for more information about prostate cancer screening and treatments, you can visit cancer.memorialhermann.org/prostate-cancer, or you can call 833-770-7771.
And we'll be right back with a preview of the new